a case of a mare that she has colic during the night. So she herself, we apply flunixin and we treat it with infrared photobiomodulation laser. This kind of laser is a cold laser. As I said before, this is a non-thermal type of laser. It's different of the diode laser that we use in ophthalmology for glaucoma or retina. This lasers is a form of therapy that uses non-ionizing forms of light delivered by let's accelerate tissue repair and decrease inflammation. You can see how swelling was the eyelid in this mare, and after 1 day of the treatment, it looks like it's improving. This is the photobiomodulation and the laser that we use, always tangential to the eye. The eyelids are closed, so the cornea or the intern eye are not in any kind of risk. This laser is so fast, so the light goes so fast and do not hurt any part of the eye. And on the third day of the treatment, you can see that the eye is open. It's only a little scar, and of course, a little corneal ulceration that we treat as any corneal superficial ulceration. And the mare looks very comfortable. Not all the cases are like that. We have different kind of traumas. You can see that here we have a conjunctiva very swell. We have chemosis, hyperemia, blepharoedema. And you can see that when we start our treatment, it was only flunixin meglumine. It was ointments with antibiotics to try to moisture this part of the conjunctiva. The eye starts to open, to improve. Another one, when I arrived, this was the eye. You can see the eyelids are very swelling. I cannot see what is inside the eye. With the days, starts to decrease the swelling. And of course, after that, the skin, you need to moisture because in almost all the cases, this happens. The bruises and the skin is dry. When he opens the eye, of course, it was a little corneal ulceration. In another cases, we can find fractures. And if you have a little part of bone that is broken, it wants to get out. So you can find fistulation, orbital cellulitis, some sequestrum. You need X-ray, in some cases ultrasound, like in this. I do not have an X-ray with me in that moment, so I decide to perform an ultrasound, and you can see the fracture. She was a filly that moves very fast in her stable, and she hurt herself. This case is a horse with a sequestrum, and you can see how he's trying to find a way to go out. Of course, in this one, we cut, we clean, and we leave a drain. In these cases, protection. We can find now different kind of masks